Vicky O'Neil comes with 28 years' experience in the NHS, with the last 12 focusing on management of medical education, simulation, quality improvement and patient safety. She says she was clear on what first needed to be done when she arrived on the Rock.
I went out and did what I called safety chats. What that enabled me to do was to speak to the staff and say to them, this is what I understand by quality improvement and patient safety. What do you understand from it? What do you think's really good in your department and works well, and what doesn't? And why doesn't it? And have you been able to make change or not?
8 months into the role, and contrary to allegations that have previously been aimed at the GHA, Ms O'Neil says the culture encourages transparency and open reporting.
One of the things this hospital did that was excellent when I got here was they reported everything. And I've never been in a hospital that actually reports everything. And they tried their very best to look at those reportings every week and try and figure it out. But that's a lot to do with a small team. So what I've done is I've come in and structured that. So we now have a weekly review of potential harm. And the whole point of all of this is that patients get the best care and we do the best learning. Because if we don't learn from this and share our learning, we don't improve. When I first got here, I had to present to the execs what I thought, and they agreed with what I thought, and they've allowed me to set these structures and processes up. They allow people time out to have these meetings and look at all of this. So there's no resistance there. There's no you can't do this or somebody must do that. It's very open and transparent, and I wouldn't be here if it wasn't, because it has to be. We can't be as safe as possible if we can't have transparency and honesty. And that's the one thing that we're heading for here, is like a just culture where everybody can speak up. They're not threatened by that. We're a long way from that, as many trusts are, but it's slowly changing, and people are realising that if we think you can do better and we tell you, it's not a bad thing. It's a good thing to do better. We should always be improving. Every day we should be looking at things we can do better.
Plans for improvements in the short term are focused on specific departments where general fixes have been identified.
The two main areas that I'm working on at the moment are theatres and maternity, because they're big areas and there is lots of room for improvement, and we're looking at the structure and the processes of that. And nothing about patients coming to harm. We just know we can make the journeys better and more robust and lean.
Visibility is also key. Ms O'Neil wants the work being done to be apparent to staff, to patients and the general public.
We are going to have patient safety boards on the walls, on the wards. So it will be a TV, and what it will show is the nursing matrix. It will show what are we doing really well and where are we improving and what are we doing about that improvement. So that's going to be up and running hopefully in the next few weeks, but the technology's been a bit interesting, shall I say. But yeah, I think that in itself is going to be a massive change, to actually have things displayed where patients can see it, relatives can see it, and people can question it. And it's allowing the public to understand that we are a complex system and we do make change and we do improve, and that's okay. It's okay to know that we didn't do something so well, but the most important thing is what are we doing to make it better.